Talking about the vaccine preventable diseases, that's the whole list of diseases that can be prevented by giving vaccine. And the ones which are in red pertain to the respiratory system. And if you look at the impact of the immunization on some of these diseases, it ranges anywhere from 92 to 100%, a great success, because when talking about prevention, it's always better than getting a disease and treating a disease. The question is, are vaccines only for kids? That is what was thought about them in past. The answer is no. Vaccines aren't just for children. Adults can be protected from 14 deadly diseases which are named here, and one of the most important of them is influenza, in short what we call as flu. Now, the vaccine preventable diseases that can be in adults, they kill hundreds of times more adults than children every year, because what we thought earlier was that perhaps children die of various kinds of diseases more, but the adults outnumber them in those diseases which are preventable. Vaccine preventable disease is due to pneumonia, influenza, and hepatitis B. Unfortunately, the adult immunization coverage levels, especially in the developing countries, are very poor. This concept has not very well been accepted. In the absence of adult immunization, many adults, especially the high-risk group, unnecessarily remain vulnerable to these diseases. What influenza is? It's a highly contagious acute respiratory illness caused by influenza viruses. It can occur in two forms, involves the respiratory system basically, in form of global pandemics and in form of annual seasonal epidemics. And we have seen recently the epidemic of the swine flu in recent past. And if you look at the history, what has happened in the past in these pandemics, lots of people have died. In the 1889-1890 Asiatic or Russian flu pandemic, 1 million people died of influenza. The Spanish flu, that was in 1918-20, about 20 to 100 million people died, which was caused by H1N1. In the Asian flu again, 1 to 1.5 million people died. In the Russian Hong Kong flu, 0.75 to 1 million. The accurate count is not available for the Russian flu, and for the recent swine flu pandemic, the deaths that occurred due to swine flu were about 18,000. So influenza is a potentially fatal disease and needs to be prevented, especially in the adults. The World Health Organization globally reports approximately 500 million cases of influenza. Talking about the symptoms, the common symptoms of influenza are fever, headache, dry cough, cold, sore throat, and only involves the respiratory system, spreads by droplets from person to person, from human to human contact mostly, but other forms of transmission can also occur. Complications that can occur in the influenza, although it is a self-limiting disease, but often it is complicated by bacterial pneumonias, otitis media, sinusitis, and those persons who are having pre-existing diseases like asthma, COPD, CHF, diabetes, worsening of their chronic medical conditions can occur because of influenza if develops in these people. And there you find there are more that can cause influenza. There are three types of influenza viruses, A, B, and C. Influenza A and B are responsible for the seasonal epidemics. The influenza A virus can infect humans, animals, as well as birds. Whereas WC recommends that it should be only those people, the influenza vaccine should be given who are at high risk of developing influenza-related complications like adults and children with chronic conditions such as respiratory diseases, asthma, COPD, cardiovascular diseases, coronary artery disease, CHF, diabetes, other metabolic disorders, cancer, chronic renal diseases, chronic liver diseases, immunocompromised, seniors ages 65 years or older, pregnant women, and children from 6 to 59 months. This is what WHO recommend. Doesn't recommend giving influenza vaccine to everyone. So what they say is only those people who are more vulnerable should be given influenza vaccine. It also recommends, WHO also recommends that it should also be given to those people who can transmit, because if they develop influenza, they can transmit the disease to other people who are at the risk of complications, like healthcare workers, both to prevent sickness and to prevent the spread to patients, women at all stages of pregnancy, breastfeeding mothers, household contacts of persons in high-risk groups. Coming to the Indian recommendations, there are no it's not included in the universal immunization program. In elderly, the Geriatric Society of India recommends vaccination of influenza. In FOXI, the Federation of Obstetrics Gynecology Society of India recommends to be given in pregnant females beyond 26 weeks. The Ministry of Health and Family Welfare recommends it to be given to healthcare workers, and IAP, the Indian Academy of Pediatrics, advocates use of it in children with risk factors and where the parents desire that vaccine influenza has to be given to their child. The benefits, what benefits does it provide? The seasonal influenza vaccine can reduce the likelihood of developing flu requiring medical visit by about 60%. It reduces the severity of disease in those who develop flu. So even if the disease develops, the severity may be less. And it also reduces the likelihood of transmitting infection. The vaccine also reduces the risk of complications like pneumonia by about 60%. The influenza-related hospitalization rate, because when the severity is less, the chances of hospitalization will be less, so they are reduced by 50 to 70%, 77%. And the mortality also, if the person develops influenza, the mortality rates, if person is vaccinated, it is reduced by 75 to 80%. So these are basically the advantages that not only reduces the risk of developing infection, but it can also reduce chances of complications developing, the rates of hospitalization and the mortality. How did the influenza vaccine evolve? The type A virus was isolated in the year 1933, and the first inactivated monovalent influenza A vaccine was introduced in 1938, in the next 5 years' time. In 1940, they could identify influenza type B virus, and in 1942, the first bivalent vaccine was developed, which contained both type A and type B influenza virus. And then in subsequent years, so there was a big gap after that, and till 1978, so nearly about 30 years gap was there when they could have another innovation wherein they could introduce vaccines which were prepared using different kinds of cells, the animal cells, the insect cells, and the plant cells on which the influenza vaccine was produced. And regarding the evolution of the technology, it was first in 1938. It was the egg-based influenza vaccine was introduced, and 2007 was the first culture-based influenza vaccine launched in Europe, and the US FDA recently in 2013 had the first insect cell culture-based vaccine. Now, what revolution recently has occurred in this vaccine world, especially the influenza vaccine, what we call as virus-like particles technology, VLP technology. These virus-like particles resemble viruses but are non-infectious because they do not contain any viral genetic material in them. These were developed over 40 years back for hepatitis B virus. But more recently, VLPs have been produced for components of a wide variety of virus families. VLPs can be produced in a variety of cells cultures, including mammalian cells, insect cells, yeast, and plant cells. What are the structural differences between these two kinds of virus or virus-like particles? The difference is that the virus as such would contain genetic material besides the cell wall and the antigens on the cell wall and other proteins which are present in it. But the VLPs, the virus-like particles, will have a cell wall, will have antigens on the cell wall, but will not have any genetic material. So these viruses will not be able to invade, they will never become virulent again, they will have no genetic material, but they will have all properties of producing immunity, of generating immunity in a person. How do you compare these two, attenuated versus VLP vaccines? Since VLPs lack genetic material, they provide a safer alternative to attenuated viruses which have been used till now for vaccines. So far what we have been getting is basically the attenuated virus vaccines. But when this vaccine would become available to us, this will be a safer alternative. The research suggests that VLP vaccines against influenza virus could provide stronger and longer lasting protection than conventional vaccines. So the protection that will be provided by these vaccines will also be superior, will be better than what we have been getting from the attenuated vaccines. The production begins as soon as the genetic sequence of a strain becomes available. You do not require the virus as such to produce these vaccines. As soon as the genetic sequence is available, the vaccine can be prepared with VLP. It takes as little as 12 weeks compared to 9 months for traditional vaccines, because if there's a new virus comes in, like the swine flu came in, it took them several months, about 9 months to prepare the vaccine for it, and that was a very big problem because we could not vaccinate the population anywhere in the world so that protection can be given to those who were non-infected. In earlier clinical trials, VLP vaccine for influenza have shown complete protection against both influenza A virus subtype H5N1 and the 1918 flu pandemic. So influenza VLP do not contain the genetic material but do have the antigenic material in form of hemagglutinin H and neuraminidase N and other proteins. They are present in these virus-like particles, and hence the influenza VLP vaccines are non-infectious and non-replicating with intact active antigens required for induction of both humoral and cellular immune responses. And when it comes to the coverage, the VLP vaccines also will have a wider coverage because they can also have action not only against that particular specific virus, but perhaps against other subtypes as well. So it will have a broader action than because the attenuated vaccine will only target that particular virus, whereas this can provide protection even against other subtypes as well. Since the 1950s, egg-based production process remained the standard method to produce seasonal flu vaccines. The flu H1N1 pandemic, the swine flu of 2009, highlighted the limitations, as I said, of the current egg-based methods. The main drawback has been the long 6 months period from strain isolation to final dose formulation validation. Takes a very long time, and you cannot keep waiting because if there is a pandemic, you cannot wait for that long a period. With new strains of infectious influenza virus has been produced by Catalan in collaboration with a US company, Novavax in cooperation US. They have developed a VLP-based influenza vaccine. The two kinds of vaccine have been developed. One is H1N1 vaccine, which has been approved by the Drug Controller Government of India, and the second one, the trivalent seasonal influenza vaccine, is under process approval by the DCGI. The details of travel influenza vaccine are being shared with you for your information only. It may become available to you in times to come. So it was basically research and a type B strain. It contains the three kind of immunogenic proteins that are present in form of H, which induces the neutralizing antibody, prevents the infection. The N reduces the disease severity, and the M1 has got potential to stimulate cell-mediated immunity. So, immunogenicity of the vaccine was evaluated in a trial conducted on 450 healthy Indian adults. 0.5 ml was administered intramuscularly. Hemagglutinin antibody titer was measured, and on 2 days, day 0 and day 21 post-vaccination. And out of the 450, the influenza vaccine was given to 300 individuals, placebo to 150, almost all continuous, finding out the immunogenicity of this vaccine is concerned. So friends, the advantages of Cadiflu over the live attenuated influenza vaccine are: it can be safely used in patients with allergy. It does not contain intact viral genetic material, hence they are non-infectious. It ensures exact genetic match to circulating strains. There is rapid production, because that's a very big advantage. In 10 to 12 weeks time, a new vaccine can be prepared against any new virus that emerges and can safely be given to the patients with compromised immunity, like respiratory diseases or cardiovascular diseases in form of asthma, COPD, coronary artery disease, and diabetes, etc. When it comes to indications for active immunization of adults against disease caused by seasonal influenza virus subtypes A and type B contained in the vaccine, so it can be given to the adults population as per what you consider whom to be given. The dose is a single dose of 0.5 ml. Frequency is, it has to be given every year. The influenza vaccine has to be given every year. The reason being, not only from the immunity point of view that the protection may go down, but also because the viruses keep on changing every year, and you have influenza virus vaccine available to you every year with different kinds of viruses, which WHO keeps vigilance all over the world. What is going to happen the next year? What kind of viruses are going to emerge? And they recommend which virus the vaccine is to be prepared against which particular viruses, so that every year the batch of viruses keeps changing. What about giving influenza vaccine with the pneumococcal vaccine, because both can prevent respiratory diseases? Both vaccines can be given together at one time, but giving in each deltoid, one on one deltoid, the other on the other deltoid muscle. In contrast to the pneumococcal vaccine, influenza vaccine is recommended annually, because the pneumococcal vaccine would be given perhaps only once or maybe once after 5 years. That's the recommendation as far as the pneumococcal vaccine is concerned. So if you can immunize your adult population with these two vaccines, perhaps a majority of infections that keep on occurring in lungs can be prevented. Talking about the safety and tolerability, it is safe and well tolerated by majority of the individuals. Occasional patients may develop mild side effects in form of headache, nasal congestion, low-grade fever, sore throat, or muscle cramps. Efficacy and safety in children and women has not been established, so it is not yet recommended in that particular age group. Maybe in times to come we'll have more studies done in these age groups. What precautions are to be taken? Like other seasonal influenza vaccines, it should be used with caution in individuals with moderate to severe illness with or without fever. So you're not going to immunize a person if he has had a recent episode of an acute illness in form of fever or no fever, or a patient with the less than 6 weeks period of Guillain-Barré syndrome which has occurred in that particular individual. And the contraindications for this influenza vaccine could be severe allergic reactions to any component of the vaccine. So in a nutshell, the first recombinant trivalent seasonal influenza vaccine has been developed with VLP cell culture technology, induces robust humoral response to all included strains, provides seroprotection rates against all 3 strains, it's free from egg proteins, so it is safe in individuals with egg allergy, it's free from intact viral genome, hence it is non-infectious and is very well tolerated by most of the people. Friends, what could be the future of these vaccines? Each year, scientists create an influenza vaccine that protects against a few specific influenza strains that researchers predict are going to be most common during that year. Now, scientists may be able to create a universal vaccine that can provide broad protection against numerous influenza strains using a cocktail of virus-like particles, including those that could cause future pandemics. So they can have a more number of VLPs that can be added to different kinds of viruses, and even future pandemics that may occur. So that can also be included. So you can have a kind of vaccine which the same vaccine can be given, which is going to protect against several kinds of influenza viruses. So that is what S.K.Katiyar has been able to develop, and I congratulate the Katiyar people for developing this, for having this innovation, and perhaps which is going to be very useful in times to come world over, because if you have got a technology which can produce a vaccine in a very short time, even if a pandemic comes in, even during that pandemic you are able to develop a vaccine against that particular virus, and that could save millions of people who have been dying, as you have seen in the past. That has happened in different kinds of pandemics that have happened from time to time. So that can be prevented if we have this kind of a technology. Thank you very much. Because when it comes to the timing, when to time your influenza vaccine, it will be variable from different parts of the country and different parts of the world as well, because when you have those timings, when the epidemics occur in your part, in your geographical area, before that you should be able to vaccinate them. So say like in our northern India, the peak period would be somewhere between July, August, September, October. So if you can vaccinate your population, your patients or healthy people in somewhere May, June, July or so, but it takes about 21 days for immunity to develop. So if you have done that before the epidemics, perhaps you will be able to help these people who are vaccinated. So that's one very important thing. The best thing would be as soon as because every year the batch changes. 2015 batch is available. As soon as the 2016 batch becomes available, it comes somewhere in May, June period. So I think as soon as the batch becomes available, it should be given. Then I said it should not be febrile illness or a non-febrile illness during acute illness, because the system may not be able to develop immunity against that particular virus. So if a person has been suffering from influenza and has been given antiviral drugs or any other influenza, any other viral illness, it will not be right to immunize them during that illness. You can always give little time for the system to recover, and then it should be given.